we told her we were coming here for the afternoon. She goes, oh, you don't want to go there.
Since we've been going there and talking about the open-air heroin market on the Cherry Creek Trail, it is obvious that the city of Denver is working hard to find solutions.
This is an issue that every city, downtown, urban core in our country is dealing with.
Your comments to us make it clear that our community is concerned and that the current situation is unacceptable. If we're going to talk about problems and blame, it's only fair we talk about progress and credit, which brings us back to the Cherry Creek Trail in the heart of Denver.
For those of you who use the Cherry Creek bike path, you may have seen this before. For those who don't, you may find some of the video in this story disturbing. The Cherry Creek bike path is a very popular path along Denver's Spear Boulevard. It's not only used for a bike or a jog, but for shooting up heroin in the middle of the day, right out in the open. Here's 9 News reporter Ryan Harrer.
Like any good Denver tourists,
We love it. We've tried to pack in as much as we can and every day.
Keith and Sharon Atkinson got to talking to the locals at the grocery store.
And we told her we were coming here for the afternoon. She goes, oh, you don't want to go there.
There, the Cherry Creek bike path.
Yeah, because of the drug use.
The trail with an increasingly negative reputation.
And it's too bad because it's a beautiful trail.
The Atkinsons found the reputation pretty much holds true.
It is a little disconcerting when you drive by some spots and there's groups of people that are clearly involved with something.
And if you do stop and watch, that something becomes painfully obvious, even at 11 in the morning.
And it's greatly concerning to us because we don't feel like our citizens have to endure that. And we need to get those people help, but we also need to address the problem.
Denver police say they're aware of the problem, of the blatant drug deals that happen under the bridges, of the clear push of the needle as joggers stroll by.
It's a challenge, but it's one we have to meet. We can't afford not to.
Last year, DPD made 158 drug-related arrests or citations along the trail's problem areas. Through May of this year, that number is just 38, a much lower number so far, but it's not because calls are down. They're actually up. 227 calls so far this year, compared to 314 in all of last year.
Well, you're not going to arrest your way out of a problem in this nature. So we're working closely with Parks and Rec, we're working closely with Denver's Road Home and other agencies to figure out how do we combat this problem? What is the genesis of this problem? How do we go after it?
Going after it right now includes undercover officers and increased bike patrols. We only saw one officer in the 3 hours we were on the trail, and the signs of drugs are absolutely everywhere.
We were just talking about, what are their backstories? Where do they come from?
This, just a week's worth of needles one Parks and Rec worker collected, left behind.
It's heartbreaking. It's heartbreaking.
As the addicted make an attempt to find the trail to their next high. In Denver, Ryan Harrer, 9 News.
All right, you just saw it. While drug use is obvious on the trail, Denver police only recorded 3 robberies or assaults in 2015. There have been 2 documented this year. They asked anyone who sees drug use just to call them so they can continue to track where these very mobile drug users are and the dealers are. We reached out to the mayor's office. They say they're acutely aware about what's happening along the creek. A spokesperson released a statement that says it's not acceptable and they're working on a multi-pronged approach to this problem. You can read their entire statement on 9news.com.
Denver Mayor Michael Hancock is speaking publicly for the first time about our story earlier this week that exposed the rampant drug use in public view on the Cherry Creek Trail. Heroin users shoot up just feet away from people biking and running, families who use the trail. The Denver Police Department says it has increased bike patrols in the area and is sending in homeless outreach officers. The city is simultaneously dealing with the very public violence problem on the 16th Street Mall. The mayor's been recently vocal on the mall violence. We asked to speak with him about the open-air drug traffic and use on the Cherry Creek Trail. His office instead sent us a prepared statement saying he's aware of the issue. We were hoping for some direct questions and answers, so 9 News reporter Steve Steger caught up with him at an unrelated event.
Lately, the 16th Street Mall issues, along with the Cherry Creek Trail, I'm wondering, a lot of people have said the city has an image problem. I'm wondering if you could address that.
Denver is a great city. I'm not sure that our image is changing because we have these moment in time issues that we're dealing with. And so to see anyone along the trail or anywhere else in the city sitting there shooting up and doing what they were doing along the mall is very disturbing. And we know resident Denver should experience that. And certainly we must move in with with a deep understanding and sense of firm compassion, because this is an illness, it's a disease.
Hancock also reiterated something the DPD has told us, that they don't believe that they can arrest their way out of this problem. Hancock says there's a multi-agency response working to address the drug issues along Cherry Creek. Denver City Council President Albus Brooks returns tonight after a month away in which he battled cancer and dealt with the death of his father. He walks into a city hall that's dealing with some very contentious issues. We sat down today. We've been talking a lot about some visible issues that Denver has.
Yeah.
Open-air heroin market on the Cherry Creek Trail, the violence on the 16th Street Mall. Do you agree with the mayor's assessment that we don't have an image problem related to those?
You know, I would say this is an issue that every city, downtown, urban core in our country is dealing with. We don't have any mental health care funding for the mentally ill. There is an image problem because I think most people come to Denver and they say, I didn't expect to see someone, laying down on the 16th Street Mall. Why they have that perspective, I have no idea, right?
As if we'd be immune.
Exactly. But I don't focus on that. That's not, I can't worry about the image. I have to attack the issue, right? I got to make sure that we have a plan around affordable housing, because at the end of the day, that's how you deal with this issue. People are on the street because they can't stay in a home. Those are the things that I'm focused on, and not so much on what is our image like? What is, because you can't control that. You can't control what a visitor says about someone from Iowa thinks about what Denver should look like.
Last Tuesday, we ran a story about something you may have witnessed yourself, people using and selling drugs on the Cherry Creek bike path right in the middle of the day. 9 News reporter Ryan Harris says Denver police have been busy there since his report.
Since 9 News caught a drug deal on camera, DPD's been busy catching the dealers. The city said it'd be ramping up enforcement in the area, and that appears to be true. Today, we've learned that in the days following our report, the Denver Police Department's narcotics team conducted several stings in the area. According to police records, they caught 3 suspected drug dealers on the trail last week. Police reports show one of them, Anthony Alfaro, had multiple small baggies of suspected heroin that he tried to hide from uniformed officers. These other 2, Garrett Arnold and Nestor Mendez, were both caught dealing drugs and exchanging money with a confidential informant for the narcotics unit. The CI was being supervised by an undercover officer. DPD told us last week that they regularly use plainclothes officers to do these kinds of busts on the trail. All 3 of those arrests happened near Spear and Colfax, the same area our photographer recorded video of illegal activity last week. In the week following our report, the Denver Police Department made a total of 7 arrests for possession or distribution on the trail. In Denver, Ryan Harrow, 9 News.
The problem's not just on the trail. DPD made 20 arrests involving heroin citywide in the week after the report. The department spokesperson said last week that while arrests are and will continue to be made regularly, DPD cannot arrest their way out of the issue.
It is the uglier side of Denver. Assaults on the 16th Street Mall and open drug deals and heroin use on the Cherry Creek Trail. Since 9 News reporter Ryan Hare brought us these stories, he's been asking Mayor Hancock to sit down and talk. He's agreed. Here's that conversation.
Do you believe that the city of Denver has an image problem?
I don't think we have an image problem. We're like every other city that's growing across this country, where we begin to have social media magnify the challenges we've had.
The mayor believes social media is fueling the fire, that the city doesn't really have an image issue. DPD ramped up enforcement on the 16th Street Mall and the Cherry Creek Trail in recent weeks. Arrests are slightly down from last year on the mall, but up on the trail.
Now, the Cherry Creek Trail is one that, quite frankly, was like, wow, what on earth is going on down here?
We saw more evidence of drug use on the trail Tuesday morning, but heard from several users and possibly dealers that police have been busy there. So if there's not an image issue, then why an increased presence now?
I think this year what you see is us deciding we're going to take an even greater approach with the number of officers, and we're going to do some things that we hadn't done, such as the area restrictions, to really start to get to the head of this issue.
Despite the videos of violence on the 16th Street Mall, despite the open-air drug market at Cherry Creek, Mayor Michael Hancock insists that Denver does not have an image problem.
I don't think we have an image problem. We're like every other city that's growing across this country, where we begin to have social media magnify the challenges we've had.
Social media magnifying Denver's challenges. That would seem to be the very definition of an image problem. It's not clear, at least to me, what harm Mayor Hancock thinks would be done if he said that Denver has an image problem and said that the city's addressing it. And actually, later in that same interview this week with our Ryan Hare, the mayor seemed to acknowledge the image problem with violence on the 16th Street Mall.
I'm worried about it. I'm worried about the health and safety of our citizens that are down there. You know, absolutely. And we don't want that kind of image on our mall. We don't want that kind of image staining our downtown Denver, which I believe is one of the most vibrant, dynamic downtowns in the entire country.
And there is where you see the mayor's difficult balancing act, promoting Denver as a great city, which it is, and acknowledging that it has some very public problems, which it does. In the end, words are not going to be what improves the situations. Action will. Think of the face of a drug addict. If you're fortunate enough not to personally know someone fighting addiction, perhaps what you pictured was a nameless, faceless person that you've seen on the street or here on TV. The next time you think of the face of a drug addict, I invite you to think of Maria, the woman you are about to meet. She hopes to avoid becoming one of the 500 opioid or heroin overdose deaths in Colorado this year. That's how many we had the last year. Numbers were available. But other numbers are working against Maria. The number of open spots in treatment programs. Here's Ryan Hare.
When was the last time you used?
Yesterday.
What time?
7 p.m.
Maria Small is staying at her sister's house in Wheat Ridge. The van she lives out of and gets high in all day broke down, and she wanted to get off the street, away from heroin.
Yeah, I hit a low. I have nowhere to live, and I have nothing left to give an addiction but my life. And I don't want to give it my life.
Sunday was day 4 without a needle in her arm. With it came the side effects of detox.
So I was kind of hurting yesterday. I was sweating. Got a lot of cramps and vomiting and diarrhea and all the things that happen.
Maria got up to change the laundry. She found a wet, soapy bag of heroin in a pocket.
Heroin, but I still did it. I put it in a thing and I shot it up my arm.
Recently, Maria has been looking for treatment, calling addiction recovery hotlines that show up on TV.
You know, and I've called 3 or 4 times and nobody's called me back, and I want help. I want my life back. I want to get a job. I feel that I'm ugly. I feel that I look horrible. I'm really thin, and I think I'm a beautiful woman. I'm a very smart woman.
Qualities she can't put to use, she says, because she can't get treatment. She is not alone.
We estimate 20 to 25 million Americans need that treatment today, and we have enough to treat a tenth of them, maybe 20% of them.
Dr. Robert Valak is a professor at the CU Skaggs School of Pharmacy. He works with a large team of experts in the state to combat the opioid epidemic. He's talking about an 80 to 90% treatment gap in our country amidst an unprecedented epidemic.
Every time I stick that needle in my arm, I shake. I shake because I don't know if this is going to be the one that does me in, or is this going to be the one that makes me feel so good that I'm just so happy and I could do anything,
It's an addiction that will likely take several weeks to treat in a rehabilitation center.
I'm the state's largest syringe access provider. I can't get people into treatment today.
Lisa Rayville runs the Harm Reduction Action Center, where users can go exchange needles and access naloxone, an overdose reversing drug that's saved many lives in recent years. That's the patch. The hole, a 2 to 4 week waiting period for inpatient treatment in Denver alone, and lack of access to Suboxone, a drug to treat opioid addiction.
I don't want that for my life. I don't want my family looking over at me being, oh, well, she's just another statistic, or, oh, she just fell into the cracks of heroin, and I don't want my mom to bury me like that. I don't want my kids to remember me like that. I want my kids to know that I gave it all I got to stay sober.
For Next, I'm Ryan Harrow.
The addiction experts Ryan spoke with unsurprisingly said that funding is what's standing in the way of closing that treatment gap, opening more treatment centers, and training more healthcare providers.
For weeks, we have been bringing you stories about the heroin problem along Denver's Cherry Creek Trail. Since 9 News reporter Ryan Hare started reporting on this issue, the trail has become a cleaner and safer place. However, as he tells us, that doesn't mean the drug use has stopped, has it, Ryan?
No, not at all, Kim. Of course, this doesn't solve the addiction problem. The Harm Reduction Action Center in Denver has been providing clean syringes and naloxone to drug users since 2012. Naloxone is a drug that reverses heroin overdoses. The center tracks where naloxone has been used in this Denver map, this interactive map here. All of these points show where the naloxone that they've given out has been used. And if we zoom into this area here, to give you some perspective, this is Colfax here. And if we zoom even further in, to the Cherry Creek Trail. This is Spear and Colfax. Look at the concentration of overdoses in that area. It's pretty incredible. But now users are being forced out of that area, so we could see the problem become more spread out.
It's a wonderful bicycle trail.
For those who use the trail for its intended purpose.
I'm about 7 miles from home right now.
It's been a summer full of transformation.
It's not pleasant to watch people shoot up and nod off.
The heroin problem has been happening here for a few years, but recently things got out of control.
It got really bad in the spring. And they were basically roving gangs. And it was a thing where you'd wonder, should you speed up a little bit?
Cyclists sped up, and so did the city. Police ramped up their presence, making 128 felony drug arrests this year. The Parks Department worked to collect 3,500 spent needles from the creek banks. The department also introduced a temporary directive forcing anyone found using drugs to stay out of the area for 90 days.
Law enforcement knows they can't arrest their way out of this heroin epidemic. Right now, what this has done is displaced folks, driven them more underground, and made the epidemic truly dangerous.
Lisa Rayville is the executive director of the Harm Reduction Action Center. While the creek crackdown fixes the immediate problem, Rayville doesn't believe it addresses the bigger issue.
We're in the midst of not only an opioid epidemic, but also an overdose epidemic.
The center's trained over 1,000 drug users in the last 4 years to use naloxone. It's saved 421 lives. That and increased assistance, she says, should be the focus.
They'll probably be in industrial areas and in a neighborhood near you.
For now,
I have seen a drop-off.
The Cherry Creek Trail is noticeably cleaner.
But since August, maybe July, August, there's many fewer people hanging out, cruising around.
As we wait to see where those suffering from addiction go next. The city is monitoring the efficiency of their tactics on the trail very closely right now. They're tracking arrests and the number of needles they find to see if those tactics are working. We should also say that the city always reiterates that they are doing what they can to connect drug users with treatment when possible, Kim.
Well, multi-pronged approach. All right. Thank you, Ryan.
To be honest, the city didn't appear too pleased when we highlighted that heroin is openly used and sold on a popular bike and jogging path. And when Steve Steger asked the mayor if we have an image problem, that didn't go over too well either. But Steve's back with this progress report that, yes, includes progress.
Meet the guys who pick up the stuff you and I wouldn't want to touch, even with thicker gloves.
We needed to address some more issues, especially on cleanup of some of these areas.
Scott Gilmore is their boss, the deputy director of Parks and Planning for Denver Parks and Rec.
I realized we needed some specialized individuals that could actually clean up biological waste, hypodermic needles.
After one of his park rangers was stuck by a needle while picking up trash along the path,
without a sharps,
Gilmore brought in contractors to help with cleanup instead. The contractors, along with park rangers and sometimes police, are out cleaning the same parts of the trail 3 or 4 times a week.
Over the last 2 months that we've been doing this, we've collected over 2,000 hypodermic needles.
That bears repeating.
2,000.
Collected over 2 months. And Gilmore admits after 9 News showed the public the drug use in broad daylight in a series of stories last month, it pushed even more action. These ramps to the path used to be a popular hangout, but now they have signs warning against stopping and standing. And fresh paint on the wall tells users they can't hang out under the overpasses anymore. They're now considered closed areas by city ordinance, giving cops the ability to walk up and tell them to move along.
What they were doing was drifting into the trail and actually causing some real safety concerns.
Small steps, but real ones.
And so I'm seeing it firsthand working. And it seems like we're making progress.
It may not stop the problem, but it seems to be helping. Along the Cherry Creek path, I'm Steve Steger.
We understand Denver police cameras are having a difficult time seeing parts of the Cherry Creek Trail, so Parks and Rec is going to install its own cameras to monitor problem spots and to alert police.